Thank you, Hassan.
Yeah, perfect,
I
perfect.
want I want to start with some information. As you know that Hassan, a few days back we had a video conference on the subject, and you were one of the participants. We already have started this the advocacy for health segment in CPAC, and we are talking to the relevant people here in Pakistan, to China Embassy, and to China and other partners. So now coming back to the today's presentation, health Silk Route, but the question is how. If we look at the bigger picture, we have to look at that issues which are being impacting the global structure, the issues which having some relevance for the global system. First of all, there are three diplomatic issues, and then there are two economic and social issues. Why I'm talking about these issues? Because what we have to design, if we want to take some new initiative or want to build some new cooperation mechanisms, we have to take care, or we have to also analyze that these issues to devising an instrument or some other area of the cooperation in the future. On the diplomatic side, so first of all, there's an anxiety at the global level. If you look at that, there is uneasiness among the countries. Some countries are criticizing each other. Some countries are doing some things, and nobody knows where to move forward. Second thing, there's some trust deficit. That trust issue is haunting now in the global level. So people are talking about, is some country is giving its point of view. Other countries are started to talk about, no, it's not a complete information. Data is missing, blah, blah, blah. So there's a trust deficit. And the third is division of the global community. The global community at this point of the time, they are severely divided. You can find even more than the Cold War. In the Cold War, maybe we were not that much divided. Right now, what we are seeing, even the division has been started to haunt at the regional level in the organization like European Union, like SAARC, like ASEAN. So it has started to haunt every forum. Either it's a global or it's a regional. Then on the economic side, on economic and social side, the first time in the history, we are facing two problems. In past, if there was any crisis, economic crisis, it was mainly triggered by either supply side or the demand shock or some financial sector reforms. But this time, there are entirely new dimensions. How we can say a new dimension? First of all, sorry, I think that slide has been missing. So I can give a brief on it. So there are two indicators. Number one, the closure of the economic activities. It never happened in the past. There was economic activities that going on if there was a recession, but now we are facing the closure of the business. We are facing the production facilities are getting closed. So there are a number of things that markets are being closed. So that is one dimension of the problem. And other problem that is entirely new. It never happened in our history. That is a mobility challenge. There is a restriction on the mobility, the lockdown. If we have we are witnessing from the aviation industry, from the transport sector, we are facing the problem. So this is the first time. So the challenge is economic activities is going down, and you cannot move. You cannot be mobile. So how to solve it? That will be a real challenge to the wisdom of the global leadership. How they steer it. In the context of these five issues, we have to define the health Silk Road. So what would be the objective of health Silk Road in this context we have looked? Either we will be solving the issue of the human health and the human well-being, or we will be investing on the human capital with the name of the health Silk Road, or we're looking some business activity. So the objective will clearly tell us where we want to reach. If it is an other economic activity for the business or for the business purpose, that means we will be missing some very important stuff on the other dimensions of the human or the human capital. As one of colleagues from the Shakeel Institute were talking about the global system, the Bretton Woods institution, they were designed for the welfare of the people, but the privatization has engulfed everything. So the privatization is talking about the profit. So profit is the motive, or the profit would be the motive to go for the health Silk Route or something else, or the human. But I foresee, as the Chinese leadership are talking about, they say we want the shared destiny or the prosperity of the humanity. That means they give us strong signals that it may be the human capital and the human. So second, what type of the cooperation we are looking under that? Is a building of facilities or hospital dispensaries or something like that. Or we are going to data sharing. So we have whatever data we have to share with each other. Or we are going toward the research and development. So that is a very important key. And the fourth one is a capacity building. So we have to look through health silk route, what would be the types of the cooperation, which would be the focus. If there is only building of the facility, that will not serve the purpose. Maybe there will need much more on that. Maybe we need data sharing. Maybe we need sharing of the joint capacity building for the research and development. That would be the key in the future if we want to counter epidemics or the pandemics in coming years. And the last thing is the capacity building. So my last slide would be, what would be the mode? So how we will be proceeding towards either it will be the business to business cooperation, a government to government cooperation, or how we will provide the financial resources. Will it be the loan or assistance? Loan means you are investing, you are giving the countries some loan or some debit, which is maybe in the long run, maybe increasing your problem. If you are providing them assistance, so that's mean you are helping to solve their problem. So these are the few points which I want to make. So how we are looking at a health silk route. Either this is an other economic venture or it's a human-based venture, and how we will devise our way in the context of with the problem we are facing at the global level, on the diplomatic front and on the economic and social front. And the fundamental question from my side would be, these five issues will give us a space to work together, or we have to wait for the 5 years or the 10 years down the order where we can find a way forward where we can work together. So from my side, it is a very good initiative, a very good thinking process that Mr. Hassan Asri and you are taking a lead on such a brilliant subject. But the question is, either our diplomatic or economic and social issues are allowing us to go for that? If yes, how will we find a way? Thank you so much.